Go ahead, Yvonne.
Bienvenidos. Welcome to our Hispanic Health and Wellness discussion of the Hispanic Leaders Group, Hispanic Capital Day. My name is Yvonne Buehlinger, Vice Chair of the Hispanic Leaders Group. I will have the pleasure to co-facilitate today's discussion. I thank you for joining us today, the third and last day of this virtual event. Muchas gracias. Esmeralda?
My name is Esmeralda Jaron, and I am the Director at Large with the Hispanic Leaders Group and have the honor of being the second moderator of today's event. Welcome to our Hispanic Health and Wellness panel discussion. Like during the first 2 days, we are providing Spanish interpretation simultaneously. Como en los días anteriores, hoy tenemos un experto que está traduciendo este evento al español. And the interpreter, I can go ahead and hear your interpretation. I understand. Yes, and we can hear the interpretation going on as well. Favor de seleccionar en su pantalla la sección que dice Interpretation a la mano derecha en la sección donde se hacen los ajustes. Y por favor seleccione Español. También haga clic donde dice Mute Original Audio. Le daremos unos segunditos para que haga esta función. Gracias, la interpretación ha comenzado. Thank you, everyone. Spanish interpretation has begun. During this meeting, we will hear from behavioral, dental, medical, and spiritual experts on the health and wellness of our Hispanic Latinx community. In consideration to our panelists, we ask kindly that everyone remain muted throughout the presentation. If you have any questions or comments, please add them to the chat and select everyone so we can all see them. We are tracking your questions and comments in English and in Spanish. Our panelists for today are, and I will show you our screen. Dr. Jesus Garcia Martinez, Associate Dean for Research, Professor of Clinical Health Sciences, St. Louis University, Doisy School of Health Sciences. Dr. Alexander Garza, Chief Community Health Officer, SSM Health. Dr. Steven Hernandez, General Dentist, Athenia Healthcare. Dr. Julia Lopez, Instructor of Medicine, Division of Infectious Diseases, Washington University School of Medicine in St. Louis. And Father Anthony Ochoa, Pastor All Souls Catholic Church. Thanks to our panel for sharing their expertise with us today. In the audience, we also have our Hispanic Leaders Group Chairman, Tony Maldonado, and our HLG board members. We thank all community partners as well as delegates for joining us today. Let us begin. Yvonne, the floor is yours.
This is Vic, the interpreter. May I interrupt you? Can someone please assign me as an interpreter? I'm not assigned yet as an interpreter. Sorry to interrupt.
We will give a few minutes for our interpreter to be assigned. And will you give us a sign, Vic, when you're set up?
I will let you know as soon as I am set up, yes. Diana, are you in already? And if I can't hear it, say yes. Okay. I am not yet. Got it. Thank you. Ready to go.
He's good to go.
Thank you, everyone, for your patience. And thank you to our panelists for being here today, as well as our audience and participants. The first question is for everyone on the panel. So if you have an answer to the question that I will be asking.
I'm sorry to interrupt. Interpreter here, and I believe I got kicked out as an interpreter, so there is no interpretation going on right now.
And our apologies. We will need another moment for, we're testing this new way of provided interpretation during this event. And we appreciate your patience as we test this new technology. Diana, will you give us a sign when you're ready? We have two interpreters, so perhaps one may suffice. One of you is sit up, Vic or Diana. Okay.
Need two interpreters. I'm sorry.
All right. We need it.
I have not been set up yet. I was set up, but I got kicked out.
Well, this exemplifies the challenges that people who need language access experience, even as we try to offer them this opportunity, we're also needing to ask everyone for a little patience. So we get to experience this together, and we thank you for that grace.
Esmeralda, can you please continue, because we got it set up. Okay, thank you.
Hey, thank you so much for letting us know we're ready now. And thank you everyone once again for your patience. So the question that I will be asking is for everyone on the panel here this afternoon. So as you feel that you have an answer you want to share in this regard, please go ahead. Here's the question. During the pandemic, what are the greatest medical, dental, behavioral health, and spiritual needs you are seeing within the Hispanic Latinx community? Please go ahead.
Yes, I'll go ahead and kick it off. This is Dr. Garza, and hopefully everybody can hear me. So I'll just give a really brief sort of overview about some of the challenges that occurred during the pandemic. So early on, as you remember, there was really some disproportionality for who is exposed to the virus. So I'm talking about pre-vaccine when the virus initially came to the United States, and that was really a reflection of a couple of different things. So one was in the Hispanic and Latinx community, a larger percentage of those populations had higher risk of exposure. And the reasons for that are because of the different job markets that they fill. So usually service-oriented jobs, such as working in hotels, restaurants, taking public transportation, things like that. So things where you're interacting with a lot of people. And so we did see a higher incidence, not just here in St. Louis, but also nationally, of exposure to the virus, so a higher number of cases. As the pandemic progressed, though, you began to see more of the greatest needs reflecting what was in the general population, which was there was a complete slowdown of access to medical services, so preventive medical services, because the healthcare systems were so focused on the acute care needs of COVID-19. And so I had a really good conversation with my friend and colleague, Diego Avente from Casa de Salud, who told me that he saw this in the clinic as well. They weren't able to address the needs as much of the Hispanic community. And then when the healthcare systems get backed up with the work that they have going on, that trickles down then into the Hispanic community. And so we have now we're starting to get caught up. But of course, that takes time. And so a lot of unmet healthcare needs, and compound that with some other barriers, such as language barriers and cultural competency barriers, makes it that much more difficult for the Hispanic and Latinx community. So, we still have a lot of catching up to do for not just preventive services, but also managing some chronic diseases as well. So I'll stop there because I know that we have a lot of other people that would like to answer.
Perhaps Dr. Hernandez could enlighten us on the dental area.
Yes, absolutely. And I think Dr. Garza made a very, very good point with regards to the preventative aspect of things, because that's basically the crux of what dentistry entails. So I think on our end, the delay has definitely helped. I mean, has not helped with regards to the preventative care, mostly because of the need for education, not so much the in the moment treatment, especially during the pandemic. There were instances of not necessarily misinformation, but a setback with regards to what information on the dental side patients needed. I think we're finally getting back towards that. But one of the big barriers has been, again, the language barrier, especially being able to go out to those communities that have the most difficulty coming to us. Hopefully, we're slowly getting back into that, especially with other forms of accessibility, such as our dental mobile unit that's now going back to the schools, finally.
Thank you so much. And Dr. Lopez, would you have any comments in regard to the behavioral and possibly spiritual needs you're seeing in the Hispanic Latinx community at this time or during the pandemic?
Yes, absolutely. I think, in my practice, which involves seeing a lot of community members, both Spanish speaking and otherwise immigrant and refugee spaces, a lot of this, of what the pandemic has brought on has been kind of the exacerbation of trauma. And so we have the trauma that one experiences, before, like past trauma, chronic trauma, complex trauma is what we call that, historical trauma, intergenerational trauma that has been passed through from, one generation to another, depending on like what it is that that person in that family has experienced. And then, the trauma that individual or family may have experienced throughout and continues to experience throughout the pandemic. And this is both in relation to loss, which can be very complicated grief, and what does grief look like during a pandemic, and the ways in which grieving looks very different for people in general. But then you have grief in relation to what has to be restrictive because of trying to maintain a level of safety for everyone else. So there's a lot of complications to that, and being able for people to kind of process through that can be very has been at times very a lonely space for people. So trying to understand like what does social support look like in that particular place, and that has been a common occurrence, especially when we're talking about how do we do that from a cultural perspective. So I think oftentimes there is this undertone for which like all Latin people grieve and have these cultural understandings that we grieve in a similar way, and that is most definitely not the case. That there are cultural differences within our communities. I come from Venezuela. The way that we grieve and the way that we process things, it looks different. How we do those rituals are different than someone who comes from a different part of Central America or different parts of even Mexico, and even those variations look different. And so I think there is an importance of being able to understand how do you build ritual, and being able to process that that level of trauma that people may may not even quite identify as trauma in those moments during a time in which you would have done X, Y, and Z thing, but you can't in the same way as you would have otherwise. And that has been quite a learning curve for myself, as a person who's been in the behavioral health space, for 16, 17 years. So I think that that's been quite a lofty place to kind of try to figure out, how to meet the needs of our specific communities in this way.
Yes, there's a lot of process and a lot to catch up on. And Dr. Jesus Garcia Martinez, would you like to add anything else to enlighten us in this area?
Yes, I would like to emphasize also something that Dr. Garza said, and that is that even before the pandemic, there have been long-standing inequities in our country's system and structure, and in which Hispanics have not received the best of care. And that's why the Hispanic Latinx community has experienced a great deal of hospitalizations and death from COVID-19, more than other races. So also we have in the Hispanic community, we have chronic diseases and health problems like diabetes, high blood pressure, asthma, obesity, and those actually complicate the disease of COVID-19. So the need that we have right now is to decrease the health disparities. We need to decrease that gap, and we need to provide more treatment for the Hispanic and Latinx community. Thank you.
Thanks for that answer. And I think that there are some questions on the chat that perhaps can be answered from each of the perspectives. Esmeralda?
Yes, ma'am. We have a question here. It says, what is being done to create a playbook to address a future pandemic or public health for our Missouri minority communities? And that can be for any of our panel members.
Yeah, so I'll just chime in here with some thoughts. So we being here in the St. Louis area, at least with the healthcare systems, are discussing how can we capture lessons learned from the pandemic. So, and I think whoever put that in the chat box is exactly right, that we should be memorializing what we've just gone through in the last 2 years. So, and the chances are probably better than average that there will be another pandemic. The question is when. And it's important that we learn from what we've just experienced. So not just strictly for the Hispanic and Latinx community, but for the entire community, but having particular attention on both the Hispanic and Latinx community and other vulnerable populations, such as the Black community. Now that can lead to some expansive, though, I think, answers, which I think is what Jesus was leading to, which was health equity. Health equity isn't just limited to COVID-19. It is across the board with health conditions. And so even though I think there are strategies that we can identify and collect for what we experienced in the pandemic, what I typically tell people when they ask, well, what can we do for the next one? I mean, it's easy to say, well, we can improve testing and other sorts of things, but at the end of the day, really, we have to improve the overall health of the community, which is a much sort of larger issue. That's really how you protect against a future pandemic. And that means focusing on vulnerable populations and populations that are at higher risk, such as the Hispanic and Latinx community, as well as the other vulnerable communities, such as the Black community. So that was a rather expansive answer, and I apologize for that, but it can sometimes it can become very difficult to pull all of those pieces together.
Thank you, Dr. Garza. We do have another question. What is the biggest lessons learned?
I think from from a public health standpoint, which is also what my PhD is in. So I have my license in clinical social work, so behavioral health, but in my PhD is in public health. One of the main pieces I think that has been front and center for a long time in many advocating spaces. So this is not new to many like community organizing spaces or advocacy efforts, is the importance of access to care, and like what does that access mean? You know, in the state of Missouri, we talk often, and there is much conversation about what does accessibility to healthcare look like. When you have access to healthcare, then you know how does that then impact your health, right? So, and we know that there are many pieces to that. So, access to healthcare not only includes access to, you know, having insurance or health insurance, right? So things like the Affordable Care Act and the marketplace insurance, but expansion of Medicaid to cover people who would otherwise not have insurance or would be underinsured. So people who would maybe have insurance but would be highly in medical debt if they were to use that insurance, and so then it becomes kind of a null point to kind of make use of. But then you have to think about transportation system, right? So you have your transportation system in the area or in the various parts of where people are, and how does that look like in urban dense spaces like St. Louis or Kansas City, but then in rural spaces, right? Specifically, you have areas for where providers are, and then how are people gonna access those spaces? This is where telehealth becomes particularly important. Telehealth has been around for a while, but it has taken the pandemic specifically for it to become a more accessible use of providing or having provision of care. And oftentimes we still, to this day, often are reactive in nature, and versus being preventative in nature. And so, you know, and there's still debate about how we should continue to expand and grow telehealth services from a, you know, macro perspective. And I think that is one of those things that I think continues to be will be a part of a building block for really kind of thinking about how do we really actually think about health equity, as Dr. Garza mentioned and Dr. Garcia Martinez mentioned as well, and like thinking about ways in which we think about what are those building blocks, what are those programs, what are the infrastructures that actually still prohibit people from being able to get the services they need, but then also what kind of providers are available, and what are kind of the spaces for which there is missing need. In behavioral health specifically, there's a high need of psychiatry. You know, there's a huge struggle to find psychiatrists. And psychiatrists just in general, like, you know, as an entity of a specialty, but then a psychiatrist who takes insurance, you know, and that's just like very hard. That falls in line in the same way as a person as myself who's licensed, you know, finding a therapist. That is also, you know, I've called many people back and they said, you're the first person to call me back. Or I'm glad that, you know, that you're even taking people on, you know, in the first place, because you're the first person to even have an open space, or you're even offering a wait list, because people even close their wait list down. You know, and so the struggle is very real, and that people don't offer insurance for therapy. Again, there are all these different kinds of barriers that you know, make it hard for people to kind of be able to access the care in the first place, and then the continuity of that care. So what we call linkage to that care, so that people can have a reduction of that chronic kind of, you know, health over time, so that we lessen comorbidities, you know, and have, you know, healthier individuals in our community spaces. And those kinds of ideas, there are really awesome, great templates and models for which that can be done. It's about like, how do we actually appropriate those funds in a way that's going to really make those the focal point, right? Both in urban and rural spaces alike.
Esmeralda, are there, that was really insightful, Dr. Lopez. Thank you so much. Are there any other questions, Esmeralda?
There are a few other questions, which brings us to this one. What advice do you have for your patients, your clients in the community? And how do we best support children going back to school and life at this time? So we can combine those two.
So if I can, you know, the advice that I will give everybody is to please go to the clinics and get the immunizations. They have been demonstrated that the vaccines are safe. And after you get the 2 shots from the Pfizer or Moderna vaccine, you also will need the booster shot. So please go to the clinics, get the vaccines that have been approved for the different ages. So you need to check what ages the vaccine is approved for when you make the appointment. So that's one thing. Another thing that we tend to do as in the Hispanic community is that we have a language and cultural barrier. Those are challenges that we have. And sometimes we don't even want to go see a healthcare provider because we don't feel so safe going with them if they are not speaking Spanish, or if we think that they are not going to understand us. Please go see a healthcare provider and ask for an interpreter, you know, in Spanish. The healthcare provider should give you, you know, should dedicate enough time to listen to you and give you the appropriate treatment. So that's what I advise to everybody in the community.
Anyone else?
Well, I just wanted to touch on what Jesus was saying, and that is having trusted partners in the community. And I think that was especially important during the pandemic. So I don't think it's a surprise to anybody that there was a lot of disinformation swirling around the pandemic, particularly around vaccines. And I think that presents an even larger challenge when you have barriers such as either access or language or cultural competency for people to feel comfortable with you know, asking questions about vaccine or knowing who to trust. And so I think one of the lessons learned just from that previous conversation from healthcare systems was making sure that we had those trusted partners within the community so that we could be doing those things to prevent disease, such as vaccination clinics, and people in the Hispanic community would feel comfortable with going there to ask questions and to get vaccinated.
Thank you, Dr. Garza. We do have another question from the audience. It says, and my system just moved. One moment. Oh my gosh. Okay. It says, what could the Hispanic Latinx community at large do to help each other regarding wellness and healthy lifestyles, especially when gathering in groups is not yet very advisable? And this can be for any of our panel members.
I'm sorry, could you repeat that one more time? I apologize.
Absolutely. The question was, what could the Hispanic Latinx community at large do to help each other regarding wellness and healthy lifestyles, especially when gathering in groups, when right now it's not very advisable?
Yeah, so I'll just give you some thoughts off the top of my head. We are you know, getting better and better in terms of the pandemic. Less people are getting sick, there's less virus circulating. And so as you've undoubtedly noticed, more and more people are getting together in groups. But you have to make sure you're cautious about your own personal risks. So for instance, if you have an immune system that is suppressed, then you probably shouldn't be out in large groups. So, but be that as it may, what I was wanting to lead to is getting more people from the Hispanic and the Latinx community engaged in community health, to be either navigators or ambassadors for health. And so I think that's really important for people within the community to be sort of that conduit to better health. Because it's one thing, I think, for a non-Hispanic to be giving health advice, but I think it's also important that it comes from people that look like me, that understand who I am, that come from my culture, that come from my neighborhood, to also be giving this information about how to live healthy lifestyles. And so we really need to I think, to build that cadre of community health workers as well, in order to influence the overall health of the Hispanic community.
Thank you, Dr. Garza.
You
Which
know-
brings us to the next question. Oh, go ahead, Dr. Garcia.
Yeah, I just wanted to emphasize that, the Hispanic community is actually a very tight community, and we have leaned into family ties and friendship during the pandemic very heavily. So a majority of the Hispanics, they have reported that they have helped relatives or close friends also in several ways. For example, getting groceries for them, or running errands, or caring for their children, sending or loaning money to family or friends, or even outside the US as well. So we are a very close community. So I think that we need to keep doing that and talk to each other and tell them, go see your healthcare provider again, somebody you trust, and get the immunization.
Absolutely. Yvonne, would you like to go ahead and look at the next question?
Certainly. Seems like the next question goes very nicely with the discussion we're having at this point. Have disparities in health coverage impacted Missouri Hispanics? And how have this lack of health coverage impacted this community? That could be anyone.
I would start with, I think, generally speaking, if you have, let's say you have coverage of some capacity, then it kind of it can lead back to my earlier comment about who's available and what kind of availability there is, and then if you're looking for someone who's a Spanish speaker, specifically in the behavioral health space, that can be difficult because therapy, you can most definitely do therapy with an interpreter, and people do. And so that's done, and people have had good experiences with that. And so I do, suggest that to people when there is room for that. There is good work being done in relation to that, and also it can be difficult, for people to feel that they can say what they want to say, or feel that they can say what they need with an interpreter present. Sometimes it has nothing to do with interpretation, and it has everything to do with someone, even if you're from a different space culturally, like from a different country of origin, from the person that you're talking to. There is this sense of camaraderie about, yes, I'm not from Honduras, but that there is a sense of like general understanding or empathy that can be, further advanced, that a person is just explicitly telling me or asking or saying that they are looking for, that can be difficult to find in other spaces, is sometimes just purely what they want, and sometimes it has a little bit less to do with even just the language itself, and more about like feeling a level of connectedness that is difficult to emulate in any other way than just like being able to say like, I understand, in a way that can't be emulated just through language alone. And I think that is really hard, especially in behavioral health, because you are talking and there is lots of things that could be discussed in such a way that can be really, hard at times, and other things in which processing can bring a lot of levels of alleviation for people. And ultimately, that's the whole purpose, of course, to be able to have a sense of, a breath of just kind of breath of fresh air in the moment, because there are so many things happening and there are so many instances for which a person or their family is, being asked or needing to do multiple things at the same time. And so there is a necessity to understand the context and the complications that is what is expected and what is, societal implications of how we are seen as like Hispanic or like Latinx folks in general. But then when you think about people who have family members in other countries, and depending on whatever is happening in that country and how those implications are also impacting people and families who are living in the US, right, or in Missouri or whatever is happening, and some of what those struggles look like, and what is, what kind of guilt and expectations and all of those feelings that also are really wrapped up in what it means to be living in a healthy way. And so a lot of times it doesn't feel like we can talk about that. When I say we, I mean as a Latina, like we can talk about that because we're supposed to just suck it up and do it, do the things, make it happen. And when you have a pandemic and you have war and you have diplomacy and politics and people suffering, like that's not so easy, to just kind of keep doing everything just as you were doing day to day, the status quo, this maintaining the tradition. And I think this idea that we're supposed to is problematic, and yet that's kind of a part of being ingrained as part of like a process. And so I think that adds to a level of a disparity, right, of like we're just supposed to do this. This is how it's supposed to happen. And I think that that's something, a narrative that we should try to like, consider and think about how it's impacting us. And that's something that I often talk to a lot of people about, both in community settings and individually. And so it can be difficult. And I think that that's where people coming together, other partners in spaces that, support each other can be really helpful and can be really fulfilling, becomes really critical.
Thank you, Dr. Lopez. Which brings us to the question in the chat. What can be done when the insurance companies decide what medicines they will be approved and the respect that doses that were prescribed by doctors? And this can be for any one of our panelists.
Well, so I'll just give you some general thoughts. So it can become complicated for sure, and so understand where the question is coming from. At times, insurance companies, as well as state-sponsored programs, can be very difficult to work with when it comes to fulfilling what the patient and the physician have come to an agreement for a treatment plan. But as far as what can be done to change what insurance companies decide and approve, it becomes a very complex process. So insurance companies are going to base their decisions based off of what is the most commonly accepted sort of protocol for treatment of a disease or an injury or things like that. And so usually it takes a broad shift to have insurance companies change what protocols they work off. Now, that certainly doesn't mean that you can't appeal treatment plans or appeal denials for a treatment plan. You just have to stay really closely engaged with your healthcare provider to navigate that system. But I wish I had, an easy answer for you, but I don't. But so the best answer really is to work with your healthcare provider to continue to, appeal decisions from an insurance company if you believe that decision was not valid.
Thank you, Dr. Garza. All right, and earlier we also had another question, and I can address it to Dr. Hernandez. It was regarding dental care. What is being done here? Let me see. Is there anything regarding the dental health of the Hispanic Latinx community in Missouri that is different from the general population? What is different about the Latino population and the general population?
Yes, and I think again, to touch on something that was mentioned earlier, although it does apply to the general population, the telehealth aspect of dentistry has been increasing pretty dramatically. There are new actual, you can call it specialties coming out, what's called a dental therapist. Again, that impacts mostly the rural communities, which is, at least with regards to St. Louis, not where a lot of the Latin community resides. For the most part, specifically to our community, it's coming down to availability of interpretation, of breaking that language barrier, and a more common aspect of that is seeing more providers who at least have some experience with the Latin community previously. The reason for that is, it was also mentioned earlier, there are some aspects that of familiarity that keep coming into play, specifically with our community. I think once the interpretation and the telehealth are bridged a little more, we'll see a lot of that fine tuning, a lot of that focused care that some providers such as myself can give when relating to our community. It's all really coming down to expanding the functions of providers all over, not just in St. Louis.
Thank you, Dr. Hernandez. And one more question that we have here prepared for our panel members is, what are other unmet health needs you see, and what do you think are the resources needed in Missouri to address those needs at the macro level? And that can be to any of our panel members as well.
Well, I'll get us kicked off here. So, this isn't specific to the Hispanic community. There's a huge amount of unmet healthcare needs in Missouri. So, if you look globally across the United States, the state of Missouri has one of the most underfunded public health systems in the country, and that really came into play during the pandemic. On many different occasions. And so on a macro level, and then the other pieces, so that's more on the public health piece, but on the sort of healthcare delivery side, we've just now expanded Medicaid. And the process for getting people enrolled in Medicaid is backlogged, and it's continuing to see some delays in rolling it out. It's become a political football, with how it's going to be funded every year. And so, of course, that all impacts the community, and it impacts the most vulnerable community. And so from a public health perspective, there's a lot of unmet need. We need good infrastructure in order to deal with these public health issues, such as pandemics. And from a delivery side, it is also, there's a lot of need for people to have access to healthcare and access to programs to help pay for healthcare. On the broader sense, the health of the community isn't just predicated on public health and on healthcare delivery. It's on many other things, such as pay equity, access to healthy foods, stable environment, fair housing. All of these other things impact healthcare. And so if you can't really fix one without fixing the other. Otherwise, you just end up sort of chasing your tail. So it's clear to me that resources are, apologize, my phone was ringing, that there's a lot of unmet healthcare need, but it's in multiple different places that impact the whole of the community.
Thank you, Dr. Garza. Did anyone else want to elaborate?
Yeah, I'll chime back in. Something that's very, very simple, but that I have personally seen directly. Once again, through dentistry, the mobile units are trying to really reach out and meet some of that unmet need. Doing so specifically at the early ages. A lot of the public schools is where we first start seeing evidence of potential unmet needs down the road. And so one very small, very simple piece of advice with regards to children, especially if they're slowly being reintroduced to in-person teaching, is be aware of when those resources are available at these schools. Be aware of what paperwork needs to be in place. At least on the dental side of things, you can really work from an early age to fulfill a lot of the unmet needs. And that way it doesn't come down to, as Dr. Garza said, chasing your tail in the end.
Thank you, Dr. Hernandez. And we have a question from our attendees. It says, what are 1 or 2 lessons learned from the pandemic response that you are excited about leveraging as we emerge from the pandemic?
Well, again, I'll just throw my 2 cents out there. So I think one of the things that, if there is a silver lining to the pandemic, is at least from our work on the task force, was bringing together people that don't operate as closely as we did before. And so on the task force was the healthcare systems, public health, the federally qualified healthcare centers, the business community, local elected officials. We had worked with Casa de Salud with the vaccination rollout and things like that. And so one side benefit from that was everybody was talking to each other. And everybody was trying to organize around a plan to help address what needed to happen during the pandemic. And so I think that built a lot of collaboration, built a lot of bridges that I'm hoping is going to continue far after the pandemic is gone in addressing other healthcare needs.
Wonderful. And we have another question in the chat. It says, it seems to me that specifically Hispanics, the Latinx community, are a small community in St. Louis. How can we get noticed and benefit from COVID funding?
I think I will wrap that maybe question up into the earlier question about 1 or 2 things that has come from the pandemic too, is that as a nationwide, like the Hispanic Latinx community is the fastest growing population group in the nation. And so it will be the largest minority group by 2040. And so that is one thing that will be continuing as a trajectory. And so there's some interesting like information and kind of thoughts surrounding like how that kind of shifts how we see spaces also kind of attuned to kind of the general trend from a population-based standpoint. I think when you look at specifically, designation of like funds or appropriation of funds, I think appropriation of funds are always difficult, like as a general point of like contention, there's always lots of contention of appropriation of funds. But with during the pandemic, specifically, there's been, the various kinds of acts that have happened most recently with like ARPA, thinking about how are those funds, and so all of these, the cities and different municipalities and school-based programs, like getting all these different kinds of funds that they've never seen before, or maybe not in the largest quantity that they've seen before, and really being able to say, like, how are we gonna like earmark or appropriate these funds in a way that's gonna be really very functional, efficacious, with like really trying to reduce these gaps. And I think that that's where you think about already advocates and organizations that have been doing the work, being advocates in the spaces specifically for Latinx and Hispanic communities, become really critical like voices in those spaces too, because they've been around, been saying things, and then are going to continue to kind of say, like, this is how we can really bridge these gaps and bridge these resources in a real way. And the question becomes like, do we see that play out ultimately? You see those appropriations, like there have been like lots of talk about how that's being looked at on the state level, because it's just, there's been a lot of talk about how appropriation of funds have been kind of like been kind of being looked at, the ways in which they're being looked at, even in the most recent like supplemental budget that Dr. Garza kind of made a gesture to about like recently, about wondering like where are these things, like how is it kind of gonna go with the Medicaid expansion, but that's looking at the local level, and then again like all these different kind of entities. So I think there's lots of opportunity, that groups that have already been doing a lot of advocacy macro practice work to say, we have these funds, we've had these kind of ideas, we've had these templates for which we've thought about ways for engaging service and engage in really thinking about systemic change. Now, like, how do we actually make a connection in a real way? And I think that we're in this kind of pinnacle moment to really be able to do that actually effectively. So the question becomes more about, is that going to happen, actually in real time? And I think that will be interesting. And then in thinking about that, there have been groups who have populated outside or like throughout the pandemic in response to need, and so outside of the, your staple organizations, across Missouri, who have been proponents for, advocating for the care of minority groups in general, but the Hispanic and Latinx groups in general too, or specifically, one that I think about as, and that again gets to that earlier question, was one that that I like met a couple of people on this call through, is like the STL Juntos, right? Which was specifically, a very much grassroots organizing space that was all about, just like started off with just about interpretation of what was coming out about the different COVID protocols. And then, I specifically helped with the mental health piece and became like a very, we made it a very like every week, this is what we're doing in relation to behavioral health needs. And that was like my sourcing of being able to support in that way. But there was really interesting and really great works for which community members coming together and saying, how are we going to support each other? And really seeing that happen organically. And so I think that just shows, the capacity and the resiliency of our community members to really kind of push forward, despite, really tragic things happening, around us.
Right. And we have we have several other comments on the chat, and I'm going to address one in particular. It says, I understand the need for trusted community partners to help bridge the gap between the community and health institutions because of the lack of trust. However, what can the medical community do to improve the trust without our facilitation, considering communities have experienced some historical abuse and neglect in the setting? Also, when we bridge that gap and create bridges from the community to medical institutions, what can medical institutions do to protect the access and credibility we lend? Not doing so damages our credibility in the community and makes future collaborations more difficult.
Yeah, so I'll give some really brief remarks. I know we're coming up at the end of time here. And so I do think that it is important to build those bridges to the community. And it's, again, not just the Hispanic community, but our other vulnerable populations. And so part of that, I think within the healthcare sort of institutions is to build more cultural competency and more equity and inclusion within the walls of the healthcare system. And that takes a little bit of time, but so it's sort of a multi-layered thing. And so it's creating those connections out into the community with trusted community partners, but also educating and in building a competency within our healthcare systems as well. So there you go.
And are there still persistent myths out there regarding who can advocate or part of the Hispanic community? Are we still hearing any of those myths regarding COVID, the vaccine that you guys are hearing? Dr. Lopez, you're muted.
Yeah, I personally have not heard as much in that way. So I think that that's been helpful. So I think, you know, in that way, that's been a plus. But I do think that there, you know, it's just kind of like you should a kind of an ongoing process to maintain the structure of information that shouldn't be let up on. To kind of add to Dr. Garza's comment, one thing like from a internal perspective of infrastructure is that there are what we call technical assistance kinds of trainings that are done that are employed sometimes just within infrastructures of the healthcare system, but sometimes also the CDC will also provide funding for an entity to oversee a space to do assistance on a number of different specific entities. So for example, I assist in providing specifically like trauma-informed care approaches for like STI, HIV specific work and like PrEP work. And looking at that intersection of how do we provide trauma-informed specific kind of clinical care in for clinicians and providers in the healthcare system across like different kinds of entities in the Midwest, right? And so you have regions that you work with. So I think there's been an investment ultimately in different capacities to really kind of see an engagement of being able to engage this like cultural competency, as Dr. Garza is mentioning, and cultural humility, not only within infrastructures internally of like a healthcare system, like whatever it is that they do specifically and that they ask of their providers, and what is maybe asked of a department or division of their specific clinicians. But, you know, there are entities that are also in charge of really trying to bring that space not only to large healthcare systems, but to also like clinics of various capacities doing all kinds of work. And that there has been a movement of that kind, really specifically trying to really address the level of trauma that has been and continues to be a large part of where people feel an uneasiness in engaging in medical system, and that has been recognized. And that there has been active movement, some more active than others, of course, there's always a spectrum, but of what can be and what should be done and who you are employing to really kind of make that happen.
Thank you. And we're going to go ahead and now go to our next slide, which provides resources. And Yvonne, would you like to go ahead and address this?
Yes, certainly. So what a robust discussion. So many issues, you know, from behavioral health to lack of resources, interpretation, language access, macro and micro at the community level. needs of every kind. So we wanted to at least leave with our audience some of our local resources, a way to connect with entities that provide a lot of service to the Hispanic Latinx community. And so they're listed here on this slide, and you can visit their websites. We have Affinia Healthcare, Barnes Jewish Hospital and their system in many communities throughout the state. Cardinal Glennon, of course, serving children. Casa de Salud, my goodness, a doorway and welcome to the Hispanic community in our region. St. Louis Children's Hospital, again, with such stellar service to the community. The Missouri, this would be Primary Care Association. We apologize for the typo, but it's Missouri Primary Care Association has a website where our audience can find community health centers anywhere in Missouri, and all community health centers provide some level of interpretation service, whether that is telephonic, in person, or video service. And those are clinics that offer sliding fees, for example. St. Louis University Health Resource Center, and we need health resources, and a great place to go for, you know, just particulars of health resources and places that provide that meet those gaps. St. Louis University Hospital, we all know how great a service they provide, as well as Washington University Hospital, our two stellar hospitals, two of the stellar hospitals in the region, I should say. But all of these entities have a substantial number of Hispanic or Latinx patients, so we wanted to point that out and kind of provide those for our audience to keep front of mind.
Thank you, ma'am. We know that 1 hour is not sufficient time to address all the behavioral, dental, medical, and spiritual needs of our Hispanic Latinx community, but we hope that the information we provided today has given us a glimpse as to the health and wellness status de nuestra gente. Many thanks to our panel members for providing their expertise. Thank you again for our community partners and delegates for joining us today. Today's recording is available, will be available on the YouTube channel of the Hispanic Leaders Group of Greater St. Louis. You are welcome to subscribe. Yvonne, would you please adjourn our Hispanic Capital Day?
Yes, my pleasure. And this concludes our 2022 Hispanic Capital Day event. I hope you have found the experience informative and thought-provoking. I know I did. We also invite you to visit the Hispanic Leaders Group website to view our future events, become a member, and or support our mission. The website address is www.stlhlg.org. Again, that is stlhlg.org. Thanks again for your participation and have a great day. Hasta la próxima.
Gracias.
Thank you, everyone. Thank you for all the people that supported this program. Appreciate it.